now.
Do you find sometimes when you're trying to help a patient that there's self-sabotage going on and they just are resistant to even things that are going to help them?
Absolutely. For many reasons. So it could be our therapeutic alliance. They don't trust me yet. Or there's something about me and our relationship. Maybe it could be just genuine. I said something, my tone, what I had on that day, all those things.
I would think it has nothing to do with you. I would think it has nothing to do with you, but it has more to do with them just not feeling like they deserve to live a better life.
Both.
That's what I see.
Both. Let me tell you why. Because I think that sometimes when you sit high and you look low as providers, what we can do is create distance. And so if I don't come in the room in a human experience, being willing to understand that person's point of view, and also honestly being willing to change an appropriate amount in order to be in relation with that person, that can be off-putting. So I think there's the provider side, there's the my side. I also think there's the person side where they're afraid of success, they're afraid of failure, they're afraid of what does this mean, they're afraid of getting close, they're afraid of being alone. It's just fear all the way around. And that comes back to epistemic trust, right? That comes back to what they've experienced before, who's betrayed them, did they actually have an appropriate attachment? I think I get a unique opportunity to actually form a genuine human connection with a person and care about them in a way that can be scary. And so part of my job is to understand that about this relationship, that it can be scary. And if this relationship is scary to them, are there things I can do to make it safer? And sometimes it's just about calling out the obvious, in that, are you sabotaging? Are you ready for this? Do you need something else before you're ready for a real intervention, right? It's like, should I slow down? I think it's a dance, and I think it goes both ways. And I think to really help a person, you got to be willing to get in the dance with that person.
And Dr. Stansel, what would you say is the most important lesson you've learned in all your years of doing this?
Oh, wow. Yes, great questions.